Which removable retainers are better, vacuum formed or classic Holey? In recent years, we saw a lot of studies on this issue. However, in my view, it's very tricky to assess the effectiveness of a retainer on patients who are very different from one another, dentally, skeletally, in terms of the treatment methods, treatment duration, etc. Hi, my name is Alex Dietmarov. I'm an orthodontist from Moscow, Russia, and this is Orthodontic Grammar. In this video, I decided not to look at the studies on retention, but rather first look at the three factors which, in my view, predetermine post-treatment stability, and then, keeping this three in mind, to try to give you my personal opinion on VFR's versus Holey dilemma. It is a proverbial orthodontic saying, do not expand the intercanine width. And although this rule is not as strict for the area between premolars and molars, we should try to keep our expansion rate at a reasonable level. So staying close to the initial arch form is the first and probably the most important key factor to achieve post-treatment stability. The second thing is avoiding over proclamation. Of course, you can put a bonded retainer on your flare teeth, but once it comes off, you will inevitably have a relapse in a few months. And if it was really an extraction case, you probably have overlooked and treated it in a non-extraction manner. You won't fix that amount of crowding by wearing a removable retainer for a week or so. You will have to go for a full circle of retreatment. And the last thing, which is very important, is a good interdigitation. This is very simple. The tighter the contacts are, the better this keeps the teeth in place. So a good cooperation with elastics equates in a good stability. Okay, having said that, let me now try to answer the question which removable retainers are superior. Again, this is not an easy question. Honestly, I think that the perfect retainer is a good diagnosis followed by good treatment planning, followed by good treatment itself, with a good patient cooperation, and so on. However, if you would ask me to choose between a vacuum form retainer and a Holey, I'd probably go for Holey. This is simply because, in my experience, it helps with the post-treatment occlusion settling, and since most orthodontists agree on interdigitation being a key factor for stability, I think this is a reasonable choice. On the other hand, vacuum form retainers are less expensive, and if you have a vacuum former in your clinic, you can do them pretty easily and economically by yourself. Overall, I think that both options are viable. I occasionally go for one or another depending on a case, and on top of that, on most of my patients, I use the lower 3-to-3 bonded retainer because we all know that this area is very susceptible to relapse. I hope this was helpful. My name is Alex Dietmarov. This is Orthodontic Grammar. As usual, I wish you good reads and stable results. Don't forget to subscribe.